Let's move on to hyperthyroidism. Hyperthyroidism is also called thyrotoxicosis. Hyperthyroidism is a disorder caused by excessive delivery of thyroid hormone to the peripheral tissues. This hormonal excess increases the metabolic rate and heightens the sympathetic nervous system's physiological response to stimulation. As a result, cardiac output and peripheral blood flow increases. Elevated thyroid levels also increase carbohydrate, protein, and lipid metabolism. Over time, the hypermetabolic effects of excess thyroid hormone result in caloric and nutritional deficiencies. Hyperthyroidism results from many different factors, including autoimmune stimulation, as in Graves' disease, an excess stimulation of thyroid secreting hormone by the pituitary gland, thyroiditis, and neoplasms. An example of a neoplasm would be the toxic multinodular goiter, and we'll talk about that in one of the next slides. And another reason would be an excessive intake of thyroid medications. Women are at an increased risk for hyperthyroidism, being 8 times more likely than men to develop the condition. Genetic factors, such as a family history of Graves' disease, increases the risk. Other risk factors are increased iodine intake and being between 20 and 40 years of age. Graves' disease is an abnormal immune system response that causes the thyroid gland to produce too much thyroid hormone. The immune system produces a protein called thyroid-stimulating immunoglobulin that stimulates the thyroid gland to enlarge, producing a goiter. So you could have a goiter in hypothyroidism and a goiter in hyper. The disease of the eye of Graves' disease is manifested as ptosis and visual dysfunction. You can see on your screen is a picture of the talk show host Wendy Williams, who was diagnosed with Graves' disease, and she has the telltale signs of the edema and the protruding eyes. This forward protrusion of the eyeballs is known as exophthalmos. The upper lids often are retracted, and the individual has a characteristic unblinking stare. The patient may experience blurred vision, diplopia, eye pain, lacrimation, and photophobia. The inability to close the eyelids increases the risk of corneal dryness, irritation, infection, and ulceration. The treatment of Graves' disease may stabilize these symptoms, but generally does not reverse the changes in the eyes. Other manifestations of Graves include fatigue, difficulty sleeping, hand tremors, and changes in menstruation ranging from a decreased flow to no menses at all. Older patients may present with atrial fib, angina, or congestive heart failure. Hyperthyroidism can be caused by overproduction of the thyroid stimulating hormone by the pituitary gland, which stimulates the thyroid gland to produce an excess of thyroid hormones. This elevation in the thyroid stimulating hormone is often resulting from a pituitary adenoma. This secondary form of hyperthyroidism is rare. Hyperthyroidism can also be caused by an inflammation of the thyroid gland, most often the result of a viral infection. Thyroiditis is an acute disorder. You usually see it in the pediatric population that may become chronic, resulting in a hypothyroid state as repeated infections destroy thyroid tissue. I did not say, but then excessive intake of thyroid medications for, say, hypothyroidism can also cause hyperthyroidism. Toxic multinodular goiter is a thyroid tumor characterized by small, discrete, independently functioning nodules in the thyroid gland tissue that secrete excessive amounts of thyroid hormone. The cause is unknown. The symptoms of hyperthyroidism develop slowly with a toxic multinodular goiter, and neither the problem with the eyes or the skin develops. The patient with this type of hyperthyroidism is usually a woman in her 60s and 70s who has had a goiter for several years. The increase in the metabolic rate results in the following manifestations of the disease. You would have an elevated heart rate, which could cause cardiac arrhythmias, such as an AFib or a sinus tachycardia, and some of your deadly ventricular rhythms, and then heart sounds would be increased. There may be a thyroid bruit linked to increased blood flow. So when you listen over the thyroid, you could hear that characteristic shh, shh, shh. Heat intolerance, increased gastric activity resulting in increased bowel movements, an increase in appetite, but there's weight loss because of the heightened metabolism. The patient could become fatigued, again, from the heightened metabolism. They would have a nervousness, difficulty sleeping, as we said, the light to absent menses, and hair loss. Thyroid storm, also called thyroid crisis, is an extreme state of hyperthyroidism that is rare today because of improved diagnosis and treatment methods. When it does occur, those affected usually are individuals with hyperthyroidism who have experienced a stressor such as an infection or trauma or untreated DKA or manipulation of the thyroid gland during surgery. Thyroid storm is a life-threatening situation. The rapid increase in the metabolic rate that results from the excessive thyroid hormone causes hyperthermia. And by hyperthermia, we mean temperature, a core temperature of between 102 and 106, tachycardia with the heart rate above 150 usually, a systolic hypertension, so a systolic blood pressure close to 200, and GI symptoms such as abdominal pain, vomiting, diarrhea. You may see agitation, restlessness, and tremors. They're common and will progress to confusion, psychosis, delirium, and seizures if not treated. Rapid treatment is essential to preserve life. Treatment includes cooling without aspirin. Remember, aspirin increases thyroid hormone, or inducing shivering. So we want to cool them, but we don't want to induce shivering. We want to replace fluids, glucose, and electrolytes, relieve respiratory distress, stabilize their cardiovascular function, and reduce thyroid hormone synthesis and secretion. Let's do a connection check here. The patient experiencing thyroid storm is ordered to receive a beta adrenergic agent. The nurse monitors for which therapeutic effect of these medications. Is it an increased respiratory rate, increased appetite, decreased heart rate, and decreased bowel sounds? The answer is C, beta blockers slow down the heart rate. Blood tests are performed that measure the level of thyroid hormones, T3 and T4, which must be elevated to make a diagnosis of hyperthyroidism. The level of the thyroid stimulating hormone from the anterior pituitary is also measured. With primary hyperthyroidism, that means the culprit is the thyroid. Thyroid stimulating hormone is low, while T4 and T3 levels are high. A thyroid antibody test is they test the serum for TA, which is that antibody test, and it's measured to determine whether the thyroid autoimmune disorder such as Graves is causing the symptoms. So the diagnostic test for Graves would be the thyroid antibodies test. Hyperthyroidism is treated by administering anti-thyroid medications that reduce thyroid hormone production. Because these drugs do not affect the release or activity of hormone that is already formed, therapeutic effects may not be seen for several weeks. To rapidly decrease the cardiovascular symptoms of hyperthyroidism, a beta blocker such as propranolol is part of the initial treatment. Because the thyroid takes up iodine in any form, a radioactive iodine therapy concentrates in the thyroid gland and damages or destroys thyroid cells so that they produce less TH. And as I said, if you go into your ATI book and look at the chapter that is on hyperthyroidism, which is chapter 78, there's a really good section on the radioactive iodine therapy, which includes nursing actions in client education, and that is on page 527. Some patients have such enlarged thyroid glands that put pressure on the esophagus or the trachea that cause problems with breathing or swallowing. In these patients, a thyroidectomy, which is removal of all or part of the gland, is indicated. A subtotal thyroidectomy usually is performed, leaving enough of the gland in place to produce an adequate amount of thyroid hormone. A total thyroidectomy is performed to treat cancer of the thyroid, and this patient then requires lifelong hormone replacement therapy. Before surgery, the patient must be in a nearly equal state as possible, meaning not too much thyroid hormone and not too little. The patient may be given an anti-thyroid drug to reduce the hormone levels and iodine preparations to decrease the size of the gland before surgery. Again, I highly recommend that you review the material in your ATI Adult Med Surg Nursing ebook. It's on page 527 and 528. And there is a section on a thyroidectomy. And again, this section includes a really good thing on client education. It's very important that you look at the post-procedure nursing actions. And I want to draw your attention to this surgical wound here on the throat. We just had a test question on the last test, and it was someone who had an anterior laminectomy. So the incision kind of looks like that. They go in through the front into the neck. And if it's cervical, they're removing a part of the cervical disc. You don't want these patients coughing because coughing can compromise this surgical wound site. So that question, as I say, we look at every question. That question was given back to you because perhaps I didn't make it quite clear. So going forward, we all know when there's surgery done on the neck, we have to be very careful that, coughing is something that we don't want our patients to do. So, nursing considerations. We want to monitor cardiac output. So monitor their blood pressure, their pulse rate, respiratory rate, and breath sounds. You want to assess for peripheral edema. You want to suggest keeping the environment as cool and free of distractions as possible. And you want to encourage your patient to balance periods of rest with activity. Promoting visual health. So a good visual acuity test, you want to have the patient use tinted glasses or shields as protection. Because of their dry eyes, artificial tears would moisten the eyes. You can use cool, moist compresses to relieve irritation. And then at night, you can cover or tape the eyelids shut if they don't close. You can elevate the head of the bed 45 degrees at least to promote periorbital fluid decrease. And always have the patient report any pain or changes in vision. Balanced nutrition, we want a diet high in protein and carbohydrates. You want to promote in between meal snacks. 6 small meals a day is better than 3 large meals. And then again, daily weights. Improve body image. You want to very early establish a trusting relationship with your patient. Encourage them to verbalize their feelings and ask questions, and always provide reliable information. So if you don't know the answer, you say to them, I'll get back to you. And this concludes our lecture on hyperthyroidism.